Hi, welcome to the show. Today, my guest is the president of Compassionate Oregon, Anthony Taylor. Anthony has lobbied for cannabis use and how it's been introduced into the state since 1983. I have with me an expert today, and we're going to talk about the state of marijuana in Oregon. Anthony, thanks you so much for being here.
Well, thanks for having me.
Well, let's just start with maybe what's on some people's minds that still aren't used to the fact that marijuana has been legalized. Are there statistics around the effect of marijuana being legalized in Washington, Oregon, Colorado? How's it going?
Yeah, there are some statistics beginning to come out of the state of Washington and Colorado. Mostly they're showing that the sky isn't falling, kids aren't rushing to find it, people aren't overdosing on it, and people aren't getting addicted to it. So those numbers are encouraging for everybody, because if we're ever really going to get a handle on our national drug issues, whether it's marijuana all the way to opioids and heroin, we got to be honest with the people that we're trying to keep safe. And when you have good solid numbers, that's how you get good solid policy.
Okay, Compassionate Oregon, tell us about that. You're the president. What's the purpose? How did it start? How's it going?
Sure. I am the president and co-founder. The other co-founder is Cheryl K. Smith from Eugene. She was part of the Death with Dignity movement and helped craft our Death with Dignity law. We got started in 2013 as a political action committee, advocating for cannabis patients, medical cannabis patients. And in 2013, 4 years ago, we became a nonprofit organization, all volunteer board, and we lobby and we advocate for medical marijuana patient rights.
And you spend a lot of time in the legislature.
I spend way too much time, according to my wife.
And we'll get to some of what's going on in the legislature now, but let's back up and talk about patient status. How's it going for medical marijuana people right now?
Well, until marijuana was legalized, it was going pretty well for patients, actually. But once marijuana was legalized, legislators and agency heads and the governor's office started to ask the question, well, now that marijuana is legal, what do you need a medical marijuana program? Just go to the store and buy it. But it's not that simple for patients, because patients have special needs. They need continuous access to their medicine. They have to be able to take it every day, and they need higher concentrations. And the other part about the cannabis patients is cannabis patients are in a unique position when they enter the dedicated medical service, because they have cannabis in their system, and that can be problematic. Some insurance companies don't want to deal with it. So if you go in for a procedure and they discover you have THC in your system, they may or may not pay for the procedure. So those are issues facing cannabis patients outside the cannabis world, if you will. So if they're using cannabis every day and they've got to go get some medical care, it could be problematic.
Tell me about what are the common things that people are using marijuana for, cannabis to treat? What kind of ailments?
The number one cannabis condition is severe pain. That's about 89% of all the patients. But in Oregon, we've taken another step. Let me just back up for a second. Severe pain, spasms, nausea from chemotherapy and cancer treatments, and then PTSD. Those are the top four. When we added PTSD in 2013, that opened it up for all the returning vets, all first responders, anybody that's had any kind of trauma can now get it. The other thing, 2 years ago, we added pervasive and degenerative neurological conditions. So now, rather than getting a card for severe pain, you can get it for fibromyalgia or ALS or MS or Parkinson's or autism, lupus, any of the pervasive and degenerative neurological conditions. Now you can get a card for that rather than the pain from it. So that's going to help settle some things out. But, the recent National Academy of Science report reviewing 10,000 peer-reviewed papers on cannabis and health have said that it works really well for pain, for appetite enhancement and nausea suppression, and the topicals are working really well for neuropathy and things like that. So some light arthritis, carpal tunnel, with the healing salves that are being produced on the market now.
So there's no question about it. This is good stuff.
It's good stuff. It has its limits. You know, I'm not one of those, and neither is my organization, running around saying cannabis is going to cure cancer. There's some evidence resulting from experiments in petri dishes and lab animals, but there's no real human studies that have been conducted on cannabis and cancer in humans.
Now, since marijuana, you said, has become legal, recreational, things have become more difficult for medical marijuana users.
They have. It's partly because when marijuana first became legal in Oregon, the legislature said, well, there's no place for them to get it. So in July 1st of 2015, the Oregon Health Authority dispensaries, the medical marijuana dispensaries, were allowed to begin selling limited amounts of recreational marijuana to Oregon consumers. So January 1st of this year, that stopped. So all those OHA dispensaries had to go back to depending on their patients to make their living. Most of them jumped and went to the Oregon Liquor Control Commission and became licensed outlet stores.
So they left the marijuana, the medical program,
Yep.
and now they're growing for recreational.
Well, some of the growers are, but that's the dispensaries transition to OLCC retail outlets.
Okay.
No growing going on there. But so now we've
I
got
see.
40 some medical marijuana dispensaries left, and those are mostly in areas that don't allow OLCC licensed stores.
Recreational stores.
Yeah, recreational.
40 left out of how many?
430, give or take.
So the medical dispensaries have gone down by 90%.
And the problem with that is those dispensaries were the market for the medical marijuana growers that had excess after meeting the needs of their patients. And originally that was a problem because they were only allowed to have a certain amount in their possession. But in 2015, we changed those possession amounts, so it makes it a little less dangerous for the growers that have a lot of excess. Some of these growers that have 48 plants and they're dealing with 8 patients, their patients are going to suck up maybe 20 pounds, and the rest can be sent to the dispensaries. But now, though, that market's no longer available.
Now,
So that makes it tough for patients because patients can't get the good quality products they used to get because these medical marijuana growers are specialists. You know, they're experts at doing this stuff, and some of them have developed strains that are specific to conditions and specific to people and their conditions. For instance, some people can get relief from a certain strain of cannabis for migraines. Other people can't get any relief from migraines. Now, those sorts of small, dedicated strains for patients and certain conditions just aren't available in the recreational stores.
Now, part of the problem with the dynamic with the medical marijuana now is that because medical patients that had a card and had a grower, they got that marijuana, that cannabis from that grower for free.
For free. And that dynamic saves Medicare $125 million a year and drops morbidity rates by 25%. On opioid overdoses.
So this medical grower, now that he or she cannot sell the excess to a medical dispensary,
Right.
has no way there's no income there.
Nope.
So that the growers that exist now are just growing to help people.
Yep. Which is how most of them started.
Yeah.
But what happened was the big guys got in there and they started stacking cards and getting more and more and more impatient. So if you have 6 plants and each of those plants produces 2 pounds, so now you got 12 pounds and your patient only uses 2 of those, that's 10 pounds excess, and you get patient after patient after patient like that. Now you got 100 patients, you got 1,000 pounds of excess. And that was being sold across the country. Those were the big OMMP growers that were actually doing the diversion. Those were the bad actors. But they made enough money that when marijuana was legal, they could come in with high-dollar lobbyists, high-dollar attorneys, giving contributions to campaigns, and They got to write the rules for legal recreational marijuana, and it has not been good for patients.
Now, that leakage, that is that's black market, is what you're referring to.
That's correct. Well, black market and the people's market, because
Okay.
a lot of the people that are growing marijuana, say they're just growing their 6 plants. They're growing 6 plants, which is the allowed limit in their medical program. They're growing their 6 plants, and they end up with
For themselves.
Okay.
Okay.
And they end up with 4 pounds that they're not ever going to use.
Yes.
So they sell a pound to their cousin in Oak Ridge, they sell a pound to their sister in Portland, and pretty soon it's all gone. That's the people's market.
That's illegal, though.
It is illegal, absolutely, at a certain level, but a patient can be compensated, or a grower can be compensated by a patient. They don't normally do it, but for instance, if a grower is growing for his 8 patients, he's got 48 plants, he gives those 8 patients the free marijuana. Well, he can give that marijuana to any patient he wants to. They don't have to be technically signed up with him. And those people he'll charge. Mm-hmm. But he'll only charge $20, $50 an ounce rather than $140 or $200 an ounce for store prices.
So the medical patient has fewer places to go now. Fewer growers, perhaps, are stayed in.
Growers have stayed pretty steady.
Okay.
We've got about 37,000 grow sites in the state of Oregon, or medical marijuana grow sites. And we've got about, right now, I think we've got about 600 active OLCC growers.
Recreational.
Yes.
But if you want to go to an OHA dispensary, there's only 40 of them.
Well, that's true. That's OHA medical only. You can
Right.
go as a medical patient into an OLCC recreational store and buy medical marijuana.
But what do you find as a medical patient there? Do you find what you want? Is that
Sometimes it depends on how compassionate the owners are. Sometimes you find what you want, but not as often as we used to before all this transition started. And we find lesser grade, lesser quality. For instance, in the old days, the THC percentages were from 21 to 26. Now they're 12 to 18. And they're more expensive.
And what about price?
More expensive. The top shops in this state are selling marijuana for about $18 a gram. So that's, what is that? $10 a gram would be $4,500 a pound. So 18 would be almost twice that. There's some dispensaries, local dispensaries here, as a matter of fact, that sell it for $6 to $8 a gram. Mm-hmm. And that always just kind of depends on how much they have to pay for it.
Okay. So what we've seen is that the results of legalizing marijuana has not been good for the medical patient.
No, it has not.
The quality's gone down.
Price has gone
The
up.
price has gone up.
Yep.
And the availability has gone down.
Yep.
Ouch.
Yeah.
So,
and their growers that have been giving it to them for free are dwindling as well.
so that's what Compassionate Oregon is about, addressing that problem we
That's
just
correct.
talked about. How are you doing? How are you addressing
Well, we have a bill before the legislature right now that will create a new commission called the Oregon Cannabis Commission that will take over the management and administration of the Oregon Medical Marijuana Program. For years, we've been stymied by the OHA in getting better patient services, getting the phone answered 8 hours a day instead of 4 hours a day, 4 days a week. These sorts of patient services have been lacking, and so this new commission will address some of those issues and is tasked with creating a long-term goal, establishing a long-term plan for making sure that medical medical cannabis is available to medical patients for a long time to come, for the future.
The bill that's going to establish this Oregon Cannabis Association Commission will not address recreational. It's
No.
medical only.
No, it does. There's one section where, well, 2 sections. One is it allows some of these medical growers to have access to the rec market because they don't right now. And it also brings all the marijuana growers, whether they're medical or recreational, under the same system for reporting. And because of that, they're allowing some of the medical growers to have limited access. The bill allows them to put 20 pounds a year into the recreational market. So that takes care of some of that, but we're still, the medical marijuana growers in this state produce 80% of all the marijuana produced in this state, and there's no market for it anymore because they shut the dispensaries down by telling them they couldn't sell to recreational patients anymore. That law sunsetted.
And has that forced the cannabis grown by medical growers into what you call the black market or the people's market?
Yeah, it's forced them. Well, the ones that are conscientious and compassionate are sitting on it. They've got tens and sometimes hundreds of pounds of marijuana in their possession, and they're just sitting on it, but it's a great temptation. And that temptation faces the recreational growers too, because these people have invested hundreds of thousands of dollars into their operations. The medical growers have done that as well, but they've done it over the course of a couple of decades. These guys have done it in the course of a couple of years. So they've spent a couple $100,000 quickly. And so I lost my train of thought, but these these medical growers have some access to that market, and starts to bring some of that marijuana out of the black market. Gives it an opportunity. Now, there's going to be about 4,000 medical marijuana growers that can take advantage of that program. I don't know how many will, but those are the numbers we're working with.
The testing has been an issue I've heard a lot about. The pesticide testing how's that affected the situation?
It's crippled the edibles market, and it really put a chokehold on the vape pen market because of the oil. The pesticide testing requirements and parts per million levels are very stringent and have been hard to meet, and a lot of people just flat failed those tests to begin with because their soil was contaminated, which contaminated the plants that were growing in it, or they got a little bit of overspray of some pesticide that you can only have certain amounts in, and so they just fail.
2 parts per billion?
2 parts per million on a lot, and 2 parts per billion on some.
Wow.
But what happened was the protocol wasn't there. The label is a law, so no labels had cannabis on it. So the Department of Agriculture and the Oregon Health Authority got together and said, well, let's give them 60 chemicals they can use.
Yeah.
And they provide this list, but the amounts, action levels were so low that many people failed right out of the gates, and it bottlenecked everything because they were failing their tests. And so that marijuana was not getting to market. In fact, protocol calls for it to be destroyed.
Wow. Okay. Is that going to change? How's that going to get better?
They're working on it.
That?
What they're trying to do is get to how we test stuff in the state. So if there's a complaint, if a neighbor says, the cherry orchard next to mine oversprayed my garden, that's a complaint. The Department of Ag could come out and take a look at that. Or it's market driven. For instance, a few years ago, the onion growers in Eastern Oregon wanted pesticide-free certification. So the Department of Ag came out, tested all the fields, charged them appropriately, and they got it to take advantage of their market. But it created a huge bottleneck. It's starting to ease a bit now because people are learning what not to put on their plants or how to deal with what they're putting on their plants. And we're going to see that ease a bit, but the costs are not going to go down, and that's part of the problem.
The cost of the testing is just the expensive equipment.
Yep.
And that adds to the price.
That's correct.
So must have been a huge growth in testing companies.
Yes and no. It was so expensive that some of them just stepped away entirely and said, I'm not going to do it. And then 3 or 4 got certified right away.
Yeah.
And they were at the head of the pack. So
they must have been buried.
They were buried. And for a while, there was only 2 or 3 labs in the whole state that could test for pesticides. Those guys were really buried. And all the testers, all the labs that were testing, if they needed, pesticide compliance, it went to that lab, no matter what lab it came into initially, and got the pesticide certification.
The investment to do these tests is high. These machines are
$250,000, some of them. And then you have to have qualified people to operate them and interpret the data the results once they come out. That's expensive. I mean, you got to have PhD kind of guys in there. You know, when you're dealing with a mass spectrometer, for instance, not everybody knows how those work.
And they're touchy.
Yeah, they're very touchy, sensitive.
You can hurt them.
So, and then there's all the other, the other requirements of the state for licensing for recreational stuff that doesn't apply as much to medical, but it affects medical. Everything the industry does affects medical. So if these guys got to spend $250,000 on a piece of equipment and their testing costs goes up from $100 a test to $350, that affects these people that are making edibles for people.
Tests went from what to what?
$100 to $350.
And that's what it's at now?
Yes.
And those are for 10-pound lots?
Yep. Anything up to 10 pounds. So if you bring a pound in, it's going to cost $350. If you bring 10 pounds, it's going to be $350. So on the 10-pound lot, you can amortize it, right? You can kind of spread it out over those 10 pounds. $31 a pound for testing. So it's not so bad. But if you're just a little person, that's only got a couple of 3 pounds that they want to test before it goes to the market, it gets expensive in a hurry.
So we're talking about a problem of sorting out legal and illegal medical grows. Is that something how can we address that?
That's not an issue. It's all described in statute and administrative rule. If you're a licensed OLCC producer, grower, it's really obvious. And then if you're just a regular medical marijuana patient, that's pretty obvious also. The medical growers are restricted to 48 plants per address. Producers can have a lot more than that. They could have a tax lot that has 4 addresses on it, and each one of them has 40,000 square feet of canopy growing. So push is gonna come to shove, and some of these people that came in and spent a lot of money getting set up in Oregon are not gonna make it because there's too much weed in Oregon for Oregon to absorb. And those people that have, say, a $40,000 square foot canopy right now, grow site, they may only be able to use half of it in a couple of years because there's too much weed in Oregon to absorb, for the state to absorb.
So we're over capacity right now.
We were over capacity long before we ever legalized. And so what happened, rather than the OLCC going, oh, we already have all this infrastructure in place, let's expand that, they said, nope, here's a whole new set of rules, whole new set of prices, a whole new set of fees. And so now these folks...
For recreational.
And they put this whole other production, processing, and distribution system in place and is trying to push all that other stuff out of the market, so they're in charge of... They got the control of the market. But what that does is it leaves the state in a bad position because 80% of all the marijuana produced in this state is produced by the medical growers, and they got no market for it, so it diverts. And that puts the state in a big, bad position because then the feds come in and say, hey, you're diverting.
Yeah.
What's up? Let's take a look. And then they realize that we have an Oregon Liquor Control recreational store in Huntington, Oregon, population 375, that have daily sales of over 400 because they're 30 miles away from Caldwell and Nampa.
Idaho.
Yep.
Out of state.
Yep. And Boise, Caldwell, Nampa, Horseshoe Bend, Silver City, they're all coming over there because Ontario doesn't allow OLCC stores, but Huntington, 30 miles up the road, does. And all these people just come up and buy all their marijuana and they go back to Idaho. The only way to cure diversion is to legalize it across the country.
What's the progress on that? I hear that come up now. It's not dead on arrival.
It's not dead on arrival like it used to be. There's a lot of talk around rescheduling or descheduling completely. There's 29 or 30 states right now that are medical and 8 that are recreational. It's something that almost 70% of Americans support right now. So the tide is going to have to turn at the federal level before we really get a handle on containment, production levels for the recreational markets.
Now, the recreational market is really not your concern other than how it affects the medical market.
Yes, that's pretty
because
true.
You're compassionate Oregon. You're concerned about people that are needing this for all those different ailments that we described.
Mm-hmm.
You have a bill before the legislature, has it got a bill? Has it got a
Yes.
number?
House Bill 2198
2198.
dash 33. That's how many amendments there's been to
I
it
was
so
afraid
far.
to ask. 33 mean amendments? Oh, my gosh. How long is this? Is this first?
I've been working on this bill since August.
Okay.
We first sat down to draft it in August, and it's way different than what it was when we first started. When we first started, we were going to move some of the growers, medical growers, over to the Department of Ag to begin the transition of all marijuana being produced under the Department of Ag.
Yes.
That didn't have any legs, and so the other part of it was to create an Oregon Cannabis Commission. Actually, we were originally calling it a Medical Use of Cannabis Board, but things being what they are in Salem, now we've got a bill that creates an Oregon Cannabis Commission, allows access to the adult use market for medical growers, and it does a couple of other things that are just kind of technical fixes. But the key with this Cannabis Commission is it has to report back to the legislature, and that's never happened before in almost 20 years of medical marijuana program. There's never been one report back to the legislature on the status of the program or the status of the patients or how much it's costing patients for marijuana or which types of strains are the most popular for which conditions. All that sort of stuff is just never been talked about much because the OHA doesn't advocate for the medical marijuana program.
So that's going to help, I would think, legislators buy into this, the fact that it's going to have, that they're going to be able to revisit the results of what they do.
That's correct.
What's the count? Is there a head count on 2198 right now? Has it got a chance of
Yeah,
competing
it's got
with?
a chance. The co-chairs of both said that they support the two main themes of the bill, the commission and the adult access to adult use market. We're just kind of fine tuning how those couple of things work, and we expect it'll have a work session. It had a work session last night that was pushed till next Tuesday, and we expect it to come out of the committee on Tuesday night.
So when you say you're down there way too much, you're down there once a week, you're down there, okay, tell me.
I'm down there at least 3 days a week, and sometimes I'm down there morning, noon, and night. I get there at 8 o'clock in the morning, I come home at 7 o'clock at night.
What does that look like? You're in committee, you're in hearings for one, and then also you're out in the hall?
Yep, out in the hall, trying to make sure, because there's been a lot of moving parts as we've gone along. There's this bill that's already come through dealing with marijuana and the OLCC and some of the medical issues. And when we first started this session, the chairs wanted to merge the two programs together. And that took a couple of months to defeat. And then to bring my bill back up, it just kind of bubbled back up. And people go, yeah, that makes sense. We're tired of the OHA. Let's fix that. And oh yeah, there's way too much marijuana outside the system. Let's bring some of it back in. And so those are positive. I think we'll have a bill come out of committee next week. Yeah.
Oh, that's exciting.
It is exciting. So something I've been, this commission, not the commission so much, but having that report back to the legislature, I've been working on for 5 years. Because we have an advisory committee on medical marijuana, but they only report back to the OHA and then it just dies. We want it to go to the legislature so that they can make decisions based on the information they receive.
Wow. Well, we're out of time.
Wow.
Thanks so much for coming. We covered a lot of ground.
We did.
There's a lot of moving parts to this. I just want to say congratulations on your efforts.
Well, thank you.
I've seen you in the halls. I've seen how you're effective, and I wish you the best of luck.
Well, thanks. It's been a pleasure being here tonight. Thanks.
All right. Thanks, Anthony.
Mm-hmm.